of all, thank you very much, Dr. Parveen Raj, for including me in this young OSSICON at Kochi. Thanks a lot. And most of the times, the invitation is for speaking on sleeve gastrectomy, 10 steps, or gastric bypass, or converting the sleeve into sati, or so on and so forth. But this time the opportunity is different, that I am talking to my younger colleagues, and for next 8 minutes I am going to speak on ethics of flourishing in bariatric marketplace. And I bring greetings from Sir Gangaram Hospital and Bhatia Global Hospital and Endosurgery Institute. Let me first give this simple line which was taught to me in my MAMC days when I was young like you. There is a very thin line between ethical and unethical practice. What I mean to say is, at that time, obviously the bariatric surgery was not there. At that time, obviously the laparoscopic surgery was also not there. So we used to do the, for example, kidney stones. And my professor, Dr. B.S. Rana, he would always say that there is a very thin line between ethical and unethical practice. People operate by just seeing the ultrasound that there is a renal stone and they operate. They don't even get the IVP done. So what I mean to say, one should always follow the right, and even if it is not easy, but one should always ask from within that am I doing an ethical job or am I not doing an ethical job? And for doing the ethical job, I think one has to take all pre-operative, per-operative, post-operative thoughts. Pre-operative, we had the session of bariatrics patient counseling in the morning, but we always say that when the patient comes to you, we should try to tell them and try to sell them that we are not pro-surgery only. We are pro-well-being of the patient. Once they start seeing that yes, the surgeon, the doctor is helping me with the well-being of me, then only they get convinced and then only they listen to you. As Dr. Manoj was asking about, yes, you have to develop a team. You cannot be master of everything. So what we do is that ethically, I talk only about this, yes, the well-being of the patient, but we have the nutritionist, we will always have the physiotherapist, we will always have the multidisciplinary consultations also with the patient, with the other doctors, so that the patient is also convinced that it is a good team and we are going to go in for surgery for an excellent results. So for that, one has to be very, very ethical. And for per-operatively, I have seen so many surgeons, and I will show you a small video clipping just later on. So many surgeons doing the compromises. And again, I would say that please do not compromise on the quality of the surgery also. एक भी number कटना नहीं चाहिए. So our thinking is that ultimately we should train ourselves in the best possible centers, and then we should make sure that we optimize the patient very well, we do the surgery very well, and we do not do any compromise. There are surgeons who would compromise on, for example, staplers. That they would think that in order to save the cost of the staplers, they would go in for, I am not against, but I am saying that for some Indian cheap company which is giving the staplers, but this may misfire. So our thinking is that we should be ethical, we should be absolutely clear that I have to give the best to the patient. And again, there, as Dr. Shivanshu also mentioned, that we should not compare ourselves with others also. That he is the surgeon who is selling only the bypass, so I should also do the bypass. No. You should see, we should see in our own hands, if I am comfortable with sleeve gastrectomy and I am doing an excellent job of sleeve gastrectomy, I am doing the stapling, I am doing the suturing, I am leaving a drain, so definitely I am giving the results. And if I am able to do it, and definitely literature is there. All of us have seen the upsurge of sleeve gastrectomy in last few years, and you could listen to Dr. Kelvin Higo also, that how he has changed his practice from Roux-en-Y gastric bypass to sleeve gastrectomies. So our thinking is that please do not compare yourself with any surgeon. You do your best. If you are doing your best, if you are ethical, if you are giving your best, the results are going to be the best. And definitely there is a place of optimizing the patient. Many times I have seen, especially younger lot, they would jump on the patient and yes, today you have come, today you get the investigations done and tomorrow we can plan the surgery. No, our thinking is that patients want to see within your eyes the honesty and the integrity. So if you are able to optimize them well, for example, if the patient is having some respiratory challenges, you should consult the chest physician. Once they also feel that after doing the pulmonary function test, after doing the sleep apnea test, sleep studies and whatnot, if they optimize and if they are told about the patient also that yes, maybe later on after the surgery you may need some ventilation support. So once the patient is convinced, then do the surgery. Otherwise, why? We should introspect, and Dr. Parveen Raj has also told in the morning, till date, we have not been able to do as many surgeries as we should have, we could have, even in India. Why? Because of some mishap somewhere or the other. So our thinking is that we should be responsible for every patient and we should give our best to the patient. We should not do any compromises on safety. And again, I must insist, please, as a young surgeon, don't be corporate driven. That corporate will come and will tell you that this is the stapler, best stapler I have come across, so go ahead and use it and I will give it free of cost. No. Similarly, in technique also, as I mentioned, for example, if we are doing sleeve gastrectomy, all of us will fire the stapler, will retract the stomach laterally, but last stapler, most of us know that 70% of the leaks would occur at the GE junction. So if there is a doubt, there is no doubt. Means at that fire, that stapler should definitely be used without even thinking. My thinking is that please do not save the cost of one cartridge, because the cost of managing a leak sleeve is far more than the cost of that stapler. So we should definitely make sure that we are ethical pre-operatively, per-operatively, and then post-operatively also we should be ethical in that respect, that we are managing not, I'm sorry to say, not that I know how to manage diabetes or hypertension. I give the treatment of diabetes and hypertension to my physician, to my cardiologist, to my different members of the team, so that ultimately patient gets the best and they can see the integrity, they can see the honesty within you, and that will give the best possible results. So in one sentence, I would say anytime and every time, go within yourself, see and ask yourself whether this surgery I will offer to my patient, my relative, my mother, my sister, my brother or not. Once you are convinced that now the patient is optimized and then I am doing the surgery, the results have to be the best, and that's it. Thank you very much for your patient listening. Any questions?
No, I think having you in this session was very important, especially requested by the youngsters, because they were very particular that you should be addressing this, because no better person can be speaking about this hard and straight from the heart. And of course, that was a beautiful lecture from the morning and now again. And I think any questions from the floor, because these are some topics you would not find it in regular conferences or sessions in general. So, but how do you teach your colleagues who would work under you where to draw the line between ethics and unethics? Because this is something they have to get inspired. But how do we teach?
I am absolutely convinced that he knows the answer. No, I am convinced that you cannot teach. You have to be an example. As simple as that. If I start compromising on any technique or any investigation or if I, for example, there will be surgeons who will now never do suturing and they will always carry on harping. Just no, we don't do the suturing and we have done so many and still our sleeves are doing very well. No, For me, if I am doing sleeve gastrectomy, I am 100% suited sleeve gastrectomy right from top to bottom. So what I mean to say, you cannot teach until and unless you are becoming an example by doing it. So once they see, many times, I would put it this way, last week only, we had a patient of 67 years old. She was a BD smoker and whatnot, and she was chesty. So we optimized her for 7 days, and then once she was comfortable, then we went in for surgery and we did the best possible result. So if the younger people see that we are trying our best not to earn money, this money otherwise also any fool can earn. If you wanted to earn money, then you should have opened a pan wala or ice cream shop rather than doing the surgery. So our thinking is that money will automatically come if you are ethical. If you are practicing ethical works, if your integrity is well maintained, you will be able to do, and it will be it may not be a geometric progression, it may be arithmetic, but definitely it will be long lasting.
This is why I ask the questions.
Yes.
To get it from the horse. Thank you, sir. Thank you, sir.
Thanks a lot.
It was definitely inspirational for all the youngsters and also for all the integrated health professionals.
Thank you. God bless you.